Thank you so much. It's so great to be here. Appreciate you having me. Sure, certainly. Um, so my journey kind of had some zigzags in it. My undergrad degree was in psychology, and I was going to go on and get my doctorate, my PhD in psychology, right after undergrad. Um, but I ended up working for a firm, a business to business manufacturing firm. One thing led to another, and I didn't go back. I kept going and I got interested in advertising and PR and marketing. So I followed that path and worked for an advertising marketing communications firm. And I went back and took courses and got a certificate in advertising and PR. Um, but I loved that. There was a lot of energy around that. So I stayed with that firm and eventually became an executive VP. Um, but while I was there, I was always kind of feeling the pull of psychology. And in that firm, I did a lot of work with C suite executives, like strategic planning, marketing. We interacted with them on a regular basis. And in the PR part, I realized they didn't know how to present themselves to the public. So we would go to trade shows or they would do press conferences, and they really needed some help on how they were going to appear, how they were going to interact with other people. So I didn't realize it at the time, but I started doing coaching then. I had a client who was a VP level, and he went to a trade show. This was all in B2B electronics manufacturing, and he had this amazing trade show booth to get. This is where you made your connections, right? The press would come, and you'd get high level people, but he'd sit in the middle of the trade show booth on the phone the whole time, and so we started to realize. I started to realize these folks, it doesn't come naturally. A lot of them started in manufacturing. So anyway, did that. Um, and then I got to a point where I was the heir apparent and could buy out the firm. Thinking about that, but always still like, oh, psychology, but maybe I should be helping people in a different way. Well, Ernest, I got really sick. I fell ill with, it's a long story. I'm not going to go into that, but basically on vacation, I ingested a parasite that started to eat my brain. That's so anyway, I was out of work for a while. And during that time, I started to really think, do I want to buy this firm and go in this direction, or do I want to go back to psychology? So I decided to go back and then get my doctorate in clinical psychology. So, here I had this level of expertise as an executive VP of a marketing firm and started back, in clinical psychology. So, did that, took a lot of courses, loved it. And then I did my internship. And, I had all this management and business and leadership experience. In the firm, I was a leader, so I managed people, I trained people. So when I did my internship at a psychiatric hospital, inpatient, they actually wanted me to be a leader. Even while I was an intern, I got involved with trauma informed care, putting together programs. And I ended up being program director of a unit. So that gave me um, a lot of perspective about interprofessional collaboration, which is such a big right now in our field. So did that, and I decided this isn't what I want to be doing. So I became a professor and a faculty member in a doctoral program of clinical psychology. So now I'm teaching, I'm immersed in it, and I'm teaching things like personality, brain science, cognition, and loving it, and still in leadership positions because I started up a consortium, a doctoral consortium for training, and it was sites from all over the place. So the leaders of those sites, part of my job was to help them be good leaders of the students. Did that, loved it, and then I was doing like two, three jobs at once. I was an internship director. I was teaching. I was running programs. I started a community mental health clinic. So again, all this business. And I decided, okay. So then I moved to becoming a managing director of a nonprofit behavioral health firm. And while I was doing that, and even before, I started doing some consulting work because I said, I've got to be able to leverage my business experience with my psychology experience. So I had a colleague who had a successful consulting practice. I started coaching with him. I started taking workshops, and I started doing coaching and consulting. Got certified in some assessment instruments, and then as a managing director for this firm, we did a lot of consultation. So I did internal and external consultation, going out into communities, academic institutions, helping them with leadership development, helping them with program development. So I started to really fall into this role of consulting and just said, this is what I want to do. I love consulting. So I went off on my own and had a small clinical practice that I kept. And then that colleague that I had done co-coaching with years before, he was working for Vector Group. And he's like, do you want to be part of this great team? Do you want to not do all your consulting by yourself? So that's how I ended up at Vector Group Consulting. So it's it's interesting because it was a lot of zigs and zags, but it feels like everything really fit together. Like there was this succession of my prior experiences fitting my new experiences, fitting my new experiences. And I'm somebody who likes to push herself. And, I often find myself in situations going, why did I say I would do that? You know, a little imposter syndrome there, but I'm like, I'm going to go for it. So anyway, it's a really fun journey. And right. Exactly. Yeah, right, right. It was funny, as an intern in psychology, I was like interviewing people for staffing, a new unit that was going to be opening. It was just like, how did I end up here? But you're right. It was sort of, well, we know you can do it. Are you interested? And sure. So, I integrate a lot of psychological principles into what I do, but I learned a lot as I became a psychologist I learned more about how to motivate people. I learned more about communication styles that are effective. I looked back at my early leadership experience and saw, mistakes that I made or things that I didn't do as effectively. And once I became a psychologist, I kind of knew like things like as simple as motivational interviewing. Right. That sort of helped me. Understanding cognition and individual differences. Understanding diversity and that not everybody has the same experience. That really informed me as a leader, and even understanding dynamics and systems. We psychology has such a focus on systems, the interplay, the back and forth, and you change one thing, you change things on a micro level, you change things on a macro level. So, so my style changed, I guess, to becoming more aware of those things and then moderating my own work the way I interacted with people a little bit differently, like being curious, in a different way. Um, and I found that I did, as an early leader, what I see other leaders doing, which is kind of making assumptions that the same thing's going to work in lots of different situations. And, knowing so much about individual differences has really helped me a lot. So, I do have a warmth collaborative style. But as a psychologist, and I was trained as a dynamic psychologist, sort of interpersonal personality. I paid a lot of attention to that. So I also learned when to challenge, and that the timing of a challenge is important, and challenges can be important. And it's not just about addressing problematic work, it's addressing what could be problematic patterns and themes. So, I think my timing's gotten better as a consultant, and, not just as an executive coach, but then when I do consulting in large systems, like, right, right. Sure. So, it starts with the individual, right? So, if I'm doing executive coaching, or, supervising people who are doing executive coaching, um, often an organization would like to think that the problem's inside the individual. And sometimes it is. But in doing systems work in an organization, I try to determine what's really going on. Is it environmental? Is it individual? And, I do 360 assessments, I do Hogan assessments. So, really try to get to the meat of what's going on. And, we can help the individual change, but if there's a huge systemic problem, then I've got to think about, how do I address this within the organization? How do I go to other leaders in the organization? How can I be honest and say, you know, um, there are things that are really hampering this individual's performance, or hampering their ability to make a difference with their team. And we got to talk about that. So, so much, so much. So, again, and, experience as a psychologist, really learning to understand the role of culture, and then the different systems, institutions I work with are all over the place. Some really get that and have some leaders that really understand the influence of culture, and some really don't understand the influence of culture. So sometimes it's kind of education and helping people understand, and sometimes it's simply pointing it out, like, wow, this is going on. um, when I One thing that also, when I look at systems and I'm interviewing, like, somebody's boss, again, I'm right now talking about executive coaching, which often spans to larger consultation work. I'm always asking, so what role does culture have with what's going on with this individual? What role are there diversity issues involved of any kind? And so that really gives me clues about what's going on in the system too, the way that question is answered. So, um, it's interesting. So I'm working with um, a DEI VP of DEI right now, and um, well, I'm going to give you a different example. I'm going to stick with executive coaching, where I was working with someone, and from a different culture. And when I asked that question, the person's leader said, well, this person is from a different culture, but we don't really think that's relevant. And in fact, we expect everybody to act a particular way. So this was a person who this was a technology company who had just been promoted from working individually. I mean, superstar in terms of technological skills, but now was leading a team of 50 people, and diverse team. And this person's style was, they were used to, like, I'm going to work 24/7. I'm going to get this done. And why wouldn't anybody else do that? And they're a lot of culture to that, where I don't want to say exactly where because I want to de-identify, but that was ingrained in this person, not just in his personality. That was how they were brought up, and there was a cultural component to that. And they didn't get why their team was so stressed. They really empathic person, but didn't understand um, why there were low engagement scores with the team. And they were looking at, my coachee was looking at hours spent, that hours members of the team would spend on something. And like, I don't know why they're stressed. They're really only working 8 or 9 hours a day. But meanwhile, it was like, go, 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 go. So, right, right. So, high on empathy, but not so high on emotional intelligence, and also didn't understand the culture of this workforce in the United States. This person wasn't from the States. So was able to help them work with the team and understand there are different ways to motivate them. There are different ways to connect. The other thing about this person was they were they were seen when I did 360 interviews by peers and colleagues, all executive level. This person was seen as kind of a jerk, and dishonest. And as I started working with him, I was like, wow, I don't see that at all. But what happened was his interpersonal style, his body language was one of like head down, get it done, multitask. I'm going to be on the phone in this meeting, and would make promises he couldn't keep. And people felt like they were being really dismissed. So didn't understand, being present and engagement and body language. And so we worked on those things. And, I would say 4 or 5 months later, talked to his boss and was like, I am seeing amazing changes in this person, in the way he's seen, in the way he's respected, in the way he interacts with other people. And the team was getting more engaged too. And of course, I'm only going to talk to you about success stories, but that's one where the role of culture and the system and what was going on in the system. And by the way, he was getting squeezed, you know. So I have to talk about that too. Like, are these deadlines realistic? Is there something, this guy's under a lot of pressure. So, it was like working with um, the higher level of management, helping him think about how to relate to the team, and then how to come across as the way he, like a real empathic, good person, but the work culture he was from didn't support that. So, right, 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 right. Yeah, yeah, sure, sure. So, as a clinician and as a faculty member, I taught personality classes. I taught about personality disorders, and then I supervised students who worked clinically with individuals with personality disorders. So I sort of developed, a strong clinical background in personality disorders and their clinical presentation. So that sort of leads me to, now I'm doing executive coaching, and I see people that um, present with these traits that might be seen as personality disorders. I can't diagnose anybody who's not my patient, so, but I know enough to say, wow, there's these traits. And then I use the Hogan a lot, and the Hogan personality assessment, it looks at what they call the bright side. What's their personality? How do they show up? Their drivers, their motives, and then what they call the dark side, and what does a person exhibit under stress. So, you can look at the Hogan, especially the dark side, and there are people who have written about tracking the Hogan to personality disorders. So, if somebody's really excitable, or if somebody reacts a certain way, that might track to a certain personality disorder. So, I think that's interesting and I think that's useful. Um, but we can never, as psychologists, rely on one point of data, right? So the Hogan might suggest that, and I've seen clinicians or coaches who say like, "Oh, this person, you know, narcissist, this person sociopath," but they don't always show up that way. So the 360 instrument gives me a lot more data. Um, because it's how are they showing up? How do they interact with other people? So when we're looking at personality disorders in the workplace, I'm really looking at what are their interpersonal relationships like? Because, again, there's a lot written, the sociopath in the workplace, or, narcissistic. That's a really big thing right now, looking at that. Um, and folks with personality disorders and psych, psych do a lot of damage. And so there are people who are true sociopaths who can do a lot of damage, who leave a lot of victims in their wake. And, when that shows up in an organization, it's really about, do you see what's going on and how much damage do you want to instill? So that's one way I work with folks, is looking at, the trauma, building that awareness. But in the executive coaching work I'm doing, I'm really looking at some of the personality traits that might look narcissistic, that might look like obsessive compulsive, real power, control, um, that might even look at, um, antisocial. But these folks are doing good work and they're getting themselves into trouble. So, do they show empathy for other people? Do they have any emotional intelligence? And, depending on what I'm seeing, so somebody who sort of is more antisocial is never going to have empathy, right? Somebody who's narcissistic traits might have some empathy. Somebody who is borderline personality disorder or histrionic, they might need attention or have attachment issues. So I really try to think about, okay, what's going on with this person? So for a lot of people, a lot of coaching, and a lot that I've read about coaching people with personality disorders in the workplace, the idea is teach them skills so they don't act out, teach them skills so they manage themselves. And right, right. You are hearing that right, but what I'm starting to look into and do research around, and thinking about in my own work, is there's a middle step. So teaching the coaching skills is great, but what motivates this person? And the Hogan talks about motivations, but I'm looking at it more from, so if this person is narcissistic or has narcissistic traits, they're going to be motivated by, wanting to be seen as special, wanting to be seen as exceptional, wanting to be seen in a certain way. And they might have some empathy, but I would say, what I sort of submit, what I'm looking at is, even more than keeping their job, which is important, there's another level of motivation, which is, I don't want to be disgraced. I don't want to feel like people are better than me. I want to be the best at what I do. And I want people understand that. So if I can get to that motivation as to why I'm teaching the skills, so and so, if you act out and you treat people this way, or you belittle people, you're not going to be seen as a good guy. You're not going to be seen as a capable leader. You're actually going to be seen in a very different way. So if I motivate, really, right, right, that's right, that's right. Somebody with histrionic personality disorder, again, it's about like all life is a stage. I need attention. I need attention. I need to feel special. And so, again, it's sort of like, okay, well, I think the attention that you want is more positive attention, right? You don't want negative attention. So if you sweep into a room and you take over the room as a leader, and you're talking about me, people are going to roll their eyes and they're not going to want to give you the attention. But if you show up as like this great leader who manages your tendencies, your impulses to blurt things out and talk about yourself, if you can learn how to ask questions, people are going to really want to be around you, because that's what motivates. So it's like the skills come, but I don't, from my work, I don't see people believing always that the skills are important. It's like, yeah, yeah. So, you know, teach me to not blow up. But meanwhile, this person over here is trying to take my job. I know they are. So, it's like, well, okay, so let's look at how you can be successful. And then they'll buy the skills. So that's what I've seen in my work, and I haven't seen any of the research that focuses on that so much. I've seen like I've seen some research that talks about, well, you coach people with personality disorders the way you do therapy, which is like, yes, understanding them, but it's super long work and you've got to build trust, and it's this really time intensive work. So if you're coaching that way, we don't have the luxury of that much time. And we've got to really be effective. So while I do that in my clinical work, working with people with personality disorders, in my coaching work, I bring my, clinical dynamic training, but it's like, what's going to work with this person? What's going to get them to think? Because it's good for them and good for the organization. And that's where like, the organization hired. Right, right. Yeah, right. Sure. So yeah, I'm going to give you my personal email because it's shorter and easier. And so that's Dr. like doctor, DRJ as in Jean, S as in Susan, D as in DiVincenzo. So drjsd@comcast.net. And I would love to hear from people, what their experiences are. If they're like, oh, you're all wet, or wow, that sounds great. Because what I'm going to want to do if I write a book is use some case studies and clinical examples and dig in. So I've started doing the research, but boy, I'd love to hear from people and their. So even though I talked a lot about systemic issues and they're important, I think it goes back to emotional intelligence. Like, when we're looking at people and interacting with them, we've got to be able to gauge where are they in empathy and their ability to manage their own emotions and then understand what other people are feeling and managing their emotions. So I think in leadership, that separates the great leaders from the not so great leaders. And then it can so much inform the work, right? So look to emotional intelligence. Let that be the North Star. Right, right, right. Yeah. And it can be so diagnostic too. Like if people don't understand that, it's a different kind of work than if people get it, right? Right. Well, thank you so much. I really appreciate your time. It's been so fun. Thank you. Thanks so much. All right. All right.